Good morning, everyone. Good morning. I am Thomas Duke Robertson from the Oak Hill Regional Community Development Corporation. Thank you for joining in to our final countdown as we push this final week for ACA Open Enrollment. I would like for all of our navigators that are on the call to just introduce themselves and just we can go from there. First, let's see, who do we have first? Pastor Knox, you would like to introduce yourself? Pastor Knox, you're on mute. We'll come back to you, Pastor Knox. Brother Campbell, would you like to introduce yourself?
I will. Good morning, everyone. My name is Clarence Campbell. I'm a marketplace navigator located in DeSoto County, tip of Mississippi. Specifically, I live in South Haven. And I spend most of my time, it appears, working with folks in Marshall County, although I do have quite a few clients that I work with here in DeSoto County. But I'm just glad to be a part of the program and glad to let folks know that you've got about one more week to sign up to get a plan. And that's all I'll leave you with at this particular time.
All right, thanks, Brother Campbell. I see you have the Michigan on. I was rooting for you guys last
Well,
night.
thanks. Well, yeah, I don't want to be too boastful and talk too much about the Michigan Wolverines, NCAA champions. Again,
I'm happy for
thanks.
it. No problem.
All right.
Pastor Knox, I see your mic is unmuted. Would you like to introduce yourself?
Yeah, Henry Knox from Page, Mississippi, and doing our gathering and traveling. We traveled to like 4 locations, and on Mondays we located in Mount Bayou, Mississippi, at the Delta Health Center, and then on Tuesday we traveled down to Enola to Delta Health Center, and then we moved from there. Then on Friday we do our best to make it to Hollandale on Delta Health Center. And then on Wednesday, we come back home to Pace at the City Hall. And we be there on Wednesday, and we be also there on some Fridays when we get invitation and so on, and they need to meet with us. So it's been a great run, and it's been a great, I think, increase of those who are interested in signing up and getting some affordable care insurance. So thank this organization, for what we are doing to help people. I've been blessed, and I've been helped just by helping someone else.
Thank you for that, Pastor Knox. You guys are doing putting some miles on that car.
Oh yes, yes. We had to have it fixed. We had to have it in the shop, but then we got it back running.
Thank you for that, Pastor Knox. Next we have I see Miss Bogle. Would you like to introduce yourself, Miss Bogle?
Good morning.
Good morning.
I am Miss Boga, as Duke said, Patricia Boga, and I am a sister navigator and applications administrator in the from Holly Springs, Mississippi, and I cover the Golden Triangle area as well as I'm not assigned to Marshall County, but I serve quite a few consumers in Marshall County. And I've been with the organization coming up February, will be 3 years. And I have truly enjoyed the ministry that has been set forth for me and my coworkers. And it's just been wonderful. And I just want to give a special shout out to Dr. Michael Miner and Sister Lottie Miner.
Thanks for that, Ms. Boga. The next person I see that has their camera on is Ms. Beverly Courtney. Would you like to introduce yourself, Ms. Courtney?
Yes, good morning. I'm Beverly Courtney. I'm with Team Mid Delta as a navigator. Just happy to be here.
Thanks for that, Ms. Courtney. Always good to see you. Um, I don't see anyone else's camera on, so I guess I'll just start calling people who I see. Um, let's see. Or anybody would like to jump in? Ms. Jefferson, I see your camera's on. Go with you.
Good afternoon, everyone. Happy New Year to all those I haven't seen. My name is Denise Jefferson. I'm here at the headquarters at 1775 Memphis Street, Hernando, Mississippi. I'm here every day, Monday through Fridays. Monday, Tuesday, and Fridays, I'm here from 9 to 5. Wednesdays and Thursdays, the office is open from 9 to 7. So you still have time to come in to get covered. We're here to assist you. I'm also a certified navigator for the ACA. And just come on down. We're here. We have navigators here every day. Even when I come in at 11 on Wednesdays and Thursdays, Brother Campbell is here on Thursday mornings. So come on down, 1775 Memphis Street. This is the headquarters for the Oak Hill Regional CDC. Thank you.
Thank you for this, Mrs. Jefferson. Ms. Bettina Campbell, like to introduce yourself?
You're on mute, Bettina.
Good morning, everyone. My name is Bettina Campbell. I am the Special Populations Administrator for Oak Hill Regional Community Development Corporation. I'm also a navigator. And what being a special court administrator means is that, unfortunately, sometimes when we're working with consumers, they don't always qualify for one of the insurance plans, but they still need health care. And so our job is to try to see that no one in Mississippi that wants to have health care does not have access. So I make sure that they're connected to one of the local federally qualified health centers throughout the state of Mississippi. Also, sometimes they may have the health care, but they can't afford to pay for their medications, or they might need help getting their medications. And so I try to make sure that everybody gets medication, or if there's a specialist that they need to see, try to make sure that they get the treatment that they need to have a healthy and a quality lifestyle.
Thank you for that, Ms. Bettina, and all your hard work. I see we have Ms. Sharonda Lee. Like to introduce yourself?
Good morning, Duke. Good morning, everybody. My name is Sharonda Lee. I'm located right here in Panola County, Mississippi. I am a navigator and eager and ready to assist any and everyone with your healthcare needs. So just come on by and see us and see what we can do.
Thank you for that, Ms. Lee. Ms. Coburn?
Good morning, everyone. My name is Cornelia Coburn. I'm located in Wilson, Mississippi, Winston County. I'm a first-year navigator, and I am truly enjoying this ministry.
Thank you for that, Ms. Coburn. Ms. Means, Ms. Abigail Means?
Good morning. My name is Abigail Means. I am a navigator also for Oak Hill Regional Community Development Corporation. Oak Hill also partners with Institute of Community Services Head Start, and we also this past year had faith-based and community meetings that Head Start set up, and we partner with. Also, it's a blessing for ICS parents, for the Head Start parents, to be shared, information to be shared with them about insurance. I am a navigator in the Coldwater area. Thank you.
Thank you, Ms. Means. We'll go to Ms. Tish.
Hello, I'm Tish Dean, and I am a navigator, and also part of Team North Mississippi Head Start that is partnered with Oak Hill. I have enjoyed, working with both because just like Abigail said, we get to connect our Head Start families and with coverage, whether it's the children or the parents. And each one of us who are part of Team North Mississippi, we participate in community events, promoting the ACA or Medicaid and CHIP or whichever the families or the individuals need assistance with. And so we're just honored to be a part of this. And it's been a wonderful thing. And we've been able to help many, many families and many people in our communities and get the word out and educate them on health literacy and the importance of health coverage and everything, just preventive care and everything that comes along with it. So it's just been a wonderful partnership.
Thank you for that, Ms. Tish. Now we'll go to Ms. Sharita Smith.
Good morning, Duke. My name is Sharita Smith. I am with Team North Mississippi. I'm a navigator for the Marshall County area. I live in Holly Springs. We're ready for everybody to start giving us a call to assist in getting insurance. Please get enrolled today. Deadline is winding down. The deadline is the 16th. It's helped me a lot. It helped me get my daughter insurance once she turned 19 because I was really confused on what she was gonna do once she turned 19. And being a sister, I was easily able to cure her some insurance once she turned 19, so she never went with that. So I really thank Oak Hill for that and the partnership that we have with them. Thank you.
Thank you so much, Ms. Sharita. It's also good that your daughter was able to get insurance. Now let's go back to the Mid Delta. Ms. Carol, are you able to introduce yourself?
Good morning. Good morning. Yeah, I think I got my camera on. Good morning. My name is Jacqueline Carroll. I'm a navigator with Team Mid Delta here in Greenville, Mississippi. I work for Washington County Opportunity Head Start as mental health disability specialist, and I enjoy doing what I'm doing. Thank you.
Thank you for that, Ms. Carol. I just want to make sure that everyone that has an opportunity to introduce themselves. So it's very important that everyone who's a potential consumer across the state of Mississippi, can put a name with a face or a face with a name. So also we have on here Ms. Catelli Ramsey. Would like to introduce yourself and your location?
Good morning, everyone. My name is Catelli Ramsey. I'm with the Lafayette County area, Oxford, Mississippi. I'm a navigator and a sister, and I also work with Head Start as well.
Thank you for that, Ms. Catelli. I see Ms. Linda Lee. Would you like to introduce yourself?
Good morning, everyone. My name is Linda Lee, and I'm a sister navigator for the Team North Mississippi Head Start. I'm located in Panola County area, and I work at the base for Head Start.
Thank you for that, Ms. Lee. Ms. Nady Brazel.
Good morning, everyone. My name is Nettie Brazel, and I'm an assistant navigator with the Panola County area. And I am so glad that we're teamed up with Oak Hill Regional Community Development Corporation.
Thank you for that, Ms. Nady. Let's see who else we have here. Miss Easter Davis, are you able to introduce yourself? If not, let's go to Miss Tabitha White. Are you able to introduce yourself? If not, Miss Kelsey Palmer, are you able to introduce yourself? All right. If not, we can keep on going. I was gonna wait till to the 11:30 mark to turn it over to Miss Brenda Wilson, but I see that Miss Brenda Wilson and Miss Carol Jackson are on, so you guys can um can have your section to speak.
Good morning, good morning. I hope we can see. Oh, yeah, there we are. Good morning, Mississippi. This is Brenda Wilson and Carol Jackson down here in the Golden Triangle. Although we're in the Golden Triangle, we do serve counties in the area adjacent to us. So I just want to say this. We thank God for Dr. Minor and Sister Minor because this is a great time in America where any American person or any citizens really that live here has access to some type of health care, be it through the marketplace or through the federally qualified health centers. There's an opportunity, there are options for you to receive health care. We are so proud to know that in this day and time, although there are so many things happening in America today, one thing we have are options. We all have options. We have choices that we can make. I'm not going to do the whole spiel here. I'm going to turn to Carol in just a minute. But I do want to say this: where there is no vision, the people perish. Dr. Minor had a vision along with other founding fathers, such as, and I say founding because President Obama, he has left a legacy for all Americans to set a stance for all of the world. Because we have this opportunity, we want to influence everyone that if you have not tapped into this, please look online, go to healthcare.gov, find local help in your area. And then if you have to, call the Health and Human Services people. They will help find the help you need in order to get enrolled. This is the best time, and sometimes it seems the worst time because of all the criminal activity, but yet and still, we have options, we have choices. And I want to encourage every person, if you have not done so, at least for your children, as we heard one of our collaborators say, that, you know, their children, she didn't know what she was going to do. So if you've aged off of Medicaid or you're no longer eligible for your parents' health care because you turned 26, hey, the marketplace is a great place to start. And then if you can't get it through the marketplace, we have the federally qualified health centers. There is no reason why anyone should not have some type of health coverage. Now I'm gonna stop talking because I'm a big talker. I want Carol to just express her words to you about how she and her whole family really got involved in the process.
And hello, everybody. Hello, hello. The one thing that I love and I'm so grateful that we have options. A lot of countries and places don't have options, but we're blessed to be in a place where we have options. And this has helped me so much because I've had the opportunity to talk to my children about their health care. That's one thing I didn't have to worry about. Another thing why this touches me so, I was in the restaurant business for over 30 years. And a lot of times people working in fast food don't think they make enough money for health coverage. And so that's a burden on them. They don't know where to turn to. They didn't go to the doctor, so things in their body get worse. But I'm able to come to them and let them know that there is a coverage for you. All we got to do is check out your income and see what your specific needs are. So thank you so much, Dr. Minor. Thank you guys. I mean, for this being available for us. This is a blessing. This is one less thing we have to worry about. So I thank you guys for being a part of this great ministry.
And so the key word here is don't wait, don't hesitate. The life you cover today may be your own, or those of your loved ones, or close friends, family, neighbors, whomever's in your circle of influence. there are so many people that you would not believe that have need of some type of coverage and they don't know where to go. So we as navigators, we are privileged to be able to spread the word. We're messengers. We're health ministry messengers who can spread the word to everyone that there's help available to you. And we're so proud and thankful to all the consumers who allowed us to be a part of helping them to get this service, because, you know, sometimes, especially with all the telemarketers calling, people don't want to answer their phones.
Right.
But you know what? I have not experienced anyone to be ugly or negative. So I thank God that we have the opportunity, and we thank God for the consumers who have allowed us to be a part in helping make that decisions for them.
Yes.
Thank you so much. And God bless you, Duke, and the team.
Yes.
Thank you so much, Miss Brenda and Miss Carol. You guys really lit a fire under us for today. That just that started us on a great track to make sure that we are telling everyone about the last week of the Marketplace Open Enrollment. This is the last week and the last chance to enroll in healthcare coverage on healthcare.gov for coverage that starts on February 1st. As we approach the final days of the open enrollment period, we want to make sure that you sign up for health coverage by the January 16th enrollment deadline. After January 16th, you will only be able to enroll in health coverage if you've had certain life events, including losing Medicaid or employer health coverage, moving, getting married, having a baby, or adopting a child. Also, thanks to the Inflation Reduction Act, quality health coverage will continue to be affordable and accessible. 4 out of 5 consumers can find plans for $10 a month or less with financial help. We encourage anyone who needs health coverage to visit healthcare.gov today and review their options. Also, you've heard from pretty much all our navigators from Oak Hill Regional Community Development Corporation. Give them a call. I'm sure they will drop their information in the chat, but if not, you can just call the headquarters office and we'll get their information. We'll have them call you. Just call the headquarters office at 662-298-3584. Also, if you want to text, you can text us at 662-689-9712. Visit our websites, getcoveredms.org. We're on Facebook, Instagram, Twitter. Just type in Get Covered Mississippi and we'll pop up. And you're more welcome to inbox us, and we will definitely make sure that we get you covered. So, like I said, we didn't have anything major outlined. Our navigator just wanted to share with you guys on the importance of getting health insurance. I would just like any navigator, if you're able to just speak on the success, the highs and the lows about during this open enrollment season. And if I missed any navigators who are on the call now that would like to introduce themselves, they're more than welcome to. But it's more just let's have a conversation about the highs and the lows. I know Ms. Brenda and Ms. Carol did an awesome job. Anyone else?
Good morning. My name is Tabitha White. I do apologize. I was unable to introduce myself earlier due to a technical difficulty, but I'm here now. I work on the team with Duke, the awesome supervisor. I really enjoy working for Oak Hill. What we do at Oak Hill is very important to the community of Mississippi. I can't stress how important it is. It's very important for you all to get out there, get signed up. Sometimes you have insurance and you feel like everything is going well. The new year comes in and some things have changed and you may not have the same benefits. So it is very, very important to get out there, sign up, make sure that you have those benefits. Sometimes when you go to the doctor, you know, they're asking for insurance. Well, all the time, as soon as you walk through the door. So it's very, very, very important. Reach out to our navigators. They are awesome, awesome, awesome. And they are most certainly here to help you and assist you in any way that they can possible. Have a wonderful day.
Thank you for that, Miss White. She does such an amazing job with the tech team. She says I'm an office supervisor, but she's my boss. She keeps me in line, make sure everything is going smoothly. Anyone else who'd like to introduce themselves? I see Ms. Easter Davis put in the chat that she is a navigator with Team Mid Delta in Greenville, Mississippi. Her audio is not working, and she works with Dr. Jacqueline Moore in assisting clients with enrollment in Washington County and surrounding areas. I see Ms. Fenner is on. Ms. Fenner, would you like to introduce yourself? She is one of our application administrators.
Good morning, everyone. My name is Mary Fenner, and I'm a navigator and also application administrator with Oak Hill. If anyone is in need of any of insurance, if your children are in need, if you're no longer able to get Medicaid because you're over the income limit, or your child has aged out of Medicaid, then you can call us and we can gladly assist you with getting insurance through the Affordable Care Act. It depends on income and the size of your household and your taxed household income, but we will assist you in any way possible. As Ms. Brenda Wilson was saying earlier, also we have the federally qualified health centers that we can refer you to that can assist you with your medical needs as well. But if you are in need of Medicaid and if you think that you're still eligible for Medicaid, you can give us a call. It's 4 of us, 4 Medicaid application assistants that can assist you with applying for Medicaid. We do not approve. All we do is help you process your application and submit any other type of information that they might need in order to process your application. But right now we're talking about the navigators that can help you or assist you with getting the affordable insurance through the Affordable Care Act. And it's a blessing because we all know if you couldn't get insurance, if you wasn't able to get insurance through your job, or the family portion of it is like triple what it is for individuals, then the Affordable Care Act is for you in order to get insurance for your family. Because I know from working in the past, when I needed insurance, or I got insurance through my job, it didn't cost that much. But the minute I added my son, it jumped to like triple. So we're here to assist you to make sure that you can get what you need in order to get health insurance. And if it does not go right for you, we have other means. We have a social worker that's on our staff that can also help with getting some of the medical needs that you have. Again, my name is Mary Fenner. I am an application administrator. You can call 662-298-3584. My extension is 107. If I'm not available, if you just call the number, Ms. Jefferson will assist you the best she can, or either transfer you to someone that can. But give us a call. We're here for you. The time is running out. Even if you don't know if you qualify or not, still call us and we will help you to see if you can qualify. Because some people may think they can't, and they do. And this insurance is great. It covers all of the basic needs or that's you need to get insurance, as far as emergency room, going to the doctor. Some of the people I've known that I've helped get insurance have 0 premiums and don't have to pay anything to go see their physician. So in some they had to pay only $5 or $1 to go see. So if you have any doubts, or if you really want to know, just give us a call, 662-298-3584, and we're there willing and able to help you with your insurance needs. Have a great day.
Thank you for that, Ms. Fenner. And before we go to anyone else, let's just look at a brief testimonial that was sent to us.
My experience is I couldn't find an affordable insurance that would meet my needs. I came across Ambetter, and Ambetter was willing to work with me, would go by my gross income, and made my medical history better because I wasn't able to go to the doctor or anything like that. With Ambetter, my prices are low. It matches my income, and I don't have to pay high rates for my medicine.
We love to hear about our consumers able to get quality health insurance through Affordable Care Act. Because that's what we're about. We're about helping others across the state of Mississippi. And if just in case someone is not in Mississippi, we're able to help you connect to someone in your state to reach out. But let's go to anyone else who would like to introduce themselves before I get ahead of myself. Anyone on here would like to introduce themselves? If not, let's go to 5 things consumers need to know about Marketplace Open Enrollment. The key dates. The Marketplace Open Enrollment at healthcare.gov runs from November 1st to January 15th. Because January 15th is a federal holiday in 2024, outreach will continue for an extra day and consumers can enroll until January 16th. Otherwise, consumers will need to qualify for a special enrollment period to enroll in a marketplace plan. Coverage is affordable. That's second point. Thanks to the new law from 2022, the Inflation Reduction Act. More people qualify for help purchasing quality health coverage. If you have looked for health coverage before, it is worth a second look. 4 out of 5 healthcare.gov consumers will be able to find a plan for $10 a month or less with financial help. With the Inflation Reduction Act, millions of people will continue to qualify for tax credits that lower their premiums. Point 3, quality plans. The marketplace offers quality, comprehensive health insurance plans that provide coverage for doctor visits, emergency care, behavioral health care, preventive care, hospital care, maternity care, and prescription drugs. There are also new plans that offer similar benefit designs and more predictable services. Um, Number 4, help is available. Consumers can access navigators and other assisters in every state on the marketplace. Once again, you can reach out to us at Oak Hill Regional CDC. Our number is 662-298-3584. Again, that number is 662-298-3584. Point 5, sign up for coverage. All consumers shopping for health insurance coverage, even those who currently have health coverage through the marketplace, should enroll or re-enroll by logging into healthcare.gov. And again, you can call us to help you fill out that application and enroll in a plan. 662-298-3584. Text us at 662-689-9712. Also, CMS has designated this week the last chance week of action. We are 1 week away from the end of open enrollment for the 2024 season. Now let's go back to our conversation about what has been some highs and what's been some lows about the open enrollment season. I'm gonna pick a few people. Mr. Campbell, Ms. Boga, Pastor Knox, and Ms. Jefferson. Y'all could come up and just talk about what you've experienced for the open enrollment, the highs, lows, or however you would like to express.
Okay, well, I'll start off if no one else has an objection. Some of the highs that I've experienced is there are some new insurance providers in the marketplace this year. And so people in different counties are getting the opportunity to go to providers other than and better. One of the lows is, although there are new providers, these new providers don't have extensive networks at this particular time. And so one particular provider that, let's say, has moved into the DeSoto County, Marshall County area, I'm not going to mention their name, but a number of my consumers have enrolled in plans by this particular provider. And they're coming in as kind of what we call, what I would call a loss leader. They're undercutting some of the existing providers with silver plans by $40 or $50. So people are able to get into these particular plans without having to pay much for the monthly premium. But then too often they found out that the doctors that they're used to seeing are not a part of this new providers network, or in some cases, the medications that they've been taking are not covered. And so this is forcing people to, well, make the type of decisions that we generally have to make all the time about insurance coverage, where you're trying to choose between what's affordable to you, what doctor can you see, versus how much you have available to pay for your monthly premiums. And sometimes it does mean that you're going to have to change from a preferred medical provider to a less preferred one because of the affordability of coverage to a different plan. So one of the highs, one of the lows.
Thanks for that, Brother Campbell. Any other ones that called, Ms. Bogan, Ms. Wilson?
I would say that one of the highs, or maybe even some of the highs, we have so many consumers out there that really didn't know what to do after they lost Medicaid, or some that lost jobs and could not, keep their health insurance because, if you're retiring or if you're leaving a job that you've been with a long time, they do offer COBRA, but it is so expensive. And we've had the opportunity to introduce the affordable health care insurance through the Affordable Care Act to so many, and they have been elated and just excited about being able to get a reasonably priced health insurance. And some of the lows, I would say you have people that you want to help, you wish you could help, but they are not quite getting it or accepting the process. And so there's so many left out in the, I don't know what the word to use in the code or whatever, that don't have health insurance because they won't listen or they won't accept the fact that this insurance is good for them. I've had so many family members that enrolled in the health insurance, and it's been so beneficial to them. It has helped them a lot. And then we've made calls to others, and they have repeatedly said, no, I'm going to wait. I don't think I'll do it right now. I'll just wait. So we just want everyone to know out there that this is, I had it actually before I turned when I turned 65, I had it. And it was very helpful to me. I didn't know what I would do after I retired. Again, I could not afford the health insurance through COBRA. And when I was introduced to the Obamacare, it helped me so much. And even when I did turn 65, I was like, I don't want to let that go. Can I keep it? But once you turn 65, you have to let it go and go with Medicare. But it has been great. And we have helped so many people with this health insurance.
Also, along with what Sister Bola was saying, people don't understand how the health insurance market, how it works. So our initial step in working with consumers is we first listen to what they have to say about their healthcare concerns and their healthcare needs. As Mr. Campbell alluded to, there are so many different insurers in the different areas that provide coverage. So we listen to that consumer, we identify what their needs are, then we look at we tell them two of the things that the health insurance is based on. The plan premium is your annual income and your household occupancy. And then with that in mind, that's the basics of it. There could be some other things that can affect it. But once we do that, then we go through what we call the window shopping tool, and we look at what is in your particular area that will match with your household needs. With that being said, we have found one of the greatest highs is that there are consumers who are retiring from jobs. And when you retire, if you no longer have the employer-sponsored insurance, it becomes your responsibility to pay the premium. So we've had very great success with retiring individuals who would have had to pay over $500 a month for their premium because they were no longer under the employer-sponsored insurance. With that being said, we had a young lady recently. She retired early. She was only in her 50s, but she had the time in and she could retire. She actually is going to save about $57,000 by coming into the marketplace versus trying to keep her former employer's healthcare coverage. I'm not putting out names out there because I don't want to insult anybody, but it's just true. When you look at the dollars and cents of how this works, you find that with these options, with these choices that you can make, you can put yourself in a financially good position as well as receive quality health care. But keep in mind, it's affordable health care. It's what's reasonable for you and your pocketbook. Another high was helping grandparents who are actually rearing their grandchildren. That grandparent was working and she didn't know that by her claiming him on her income, that he had a policy now, a plan for $9.94 for her grandson who recently aged off of Medicaid. There are so many positives out there. Even with those who don't get on the program, guess what? You still have the federally qualified health centers. So there's no loophole. There's nothing that can keep you from getting some type of coverage.
Thank you for that, Ms. Patina. I see that your hand is up.
Yes, I just wanted to touch on the federally qualified health centers again. But before I do that, let me say for you, this is the navigators and the people that work at Oak Hill. This is a ministry for us. It's not just a one and done. We really care about the consumers that we provide the services to, and we want to make sure that you and your family are living your best life. So I wanted to just share the type of cases that I've worked on that were referred to me by some of our consumers. There was a young man, he was 34, and he was having vision problems, and he was almost legally blind, and he needed the services, but he couldn't qualify for the Affordable Care Act because he had no income. So the navigator called me, and working through a process, we were able to find a local and national service that the young man was able to go to request he needed his eye surgery, and he was able to get connected to the services that he needed in order so that he didn't go blind. And then we have another young man, he had insurance, but the prescriptions that the doctor had recommended as being the best for him or kind of new, and they cost way more than he could afford, he or his family. And we were able to get him connected to the pharmaceutical company that has an indigent program. And now he'll be able to get the medicine without his mom trying not go without groceries or other essential care that they need. And so just don't think I probably won't qualify. And so why should I go through the changes of trying to fill out this application? Why should I reach out? Nobody cares about what's happening to me and nobody's going to be able to help me. Please don't sit there and think that. Please reach out and let us take you through the process to see if you qualify for the Affordable Care Act or one of the other insurances. And if you don't, know that we don't just give you a sheet of paper and say, here, go to the federally qualified health center, but we take the time to reach out to the health center to get a name of a person that you can contact there, and that person will walk you through the process. So know that we are doing this for you, not just because we don't have anything to do, or not just because we might get paid, but because it's a ministry. It's a love for our fellow man. So reach out.
Thank you for that, Ms. Bettina. It is a ministry for us. Ms. Colburn, can you tell us about some experiences that you had during this open enrollment season? Okay, I saw Ms. Jefferson. Would you like to share about the highs and lows about the Affordable Care Act that you've experienced?
The only thing a couple of things that's come through here. I've had a couple of consumers that have come in with their letters that they received from the insurance that they had for last year, and they gave them a price. It was a low price that they could get their coverage for, but they didn't read all the letter because the letter said based on that particular income that they had in there, but their income was a lot more than what was on the letter they received. They was excited. They thought they was going to get insurance that was for lesser than what it really was. So we went in. I was able to go. They were reoccurring consumers, so we were able to go back in their marketplace account, and once we updated their income, that the amount that they wanted to, that they thought they were going to pay, was not what they were going to pay. So they was kind of upset about it, but they knew they had to have some coverage. It wasn't a whole lot more, but as Sister Wilson has said before, it's based on their pocketbook. It wasn't a lot more, but it was more than they thought they were going to have to pay. So I had a couple of people that came in with the letter that they had received from their insurance, wanting them to renew with them, and they would get it for lesser than they were actually eligible for. When we did the eligibility, they didn't get as much premium tax credit that they thought they were getting. But they still got coverage, and they said they would be, I think this coming up year, they'll be able to get get on Medicare. So those are a couple of things that I've had.
Thank you for this, Sister Jefferson. Say from some of our Head Start team members. Oh, I see Dr. Coburn has came on. Would you like to share the highs and lows?
Yeah, I was just I think the main thing that I'll come across is that people thinking that they're locked into their choice, and I was letting them know that you're not locked in. You could always change during the open enrollment period. You're not just stuck with that particular insurance that you had last year, and then you can still make changes up until the time that open enrollment closes.
Thank you for that, Dr. Coburn. Let's go to the Head Start. Ms. Tish, what have you seen as far as open enrollment? Sheer highs and lows.
Hi. Well, mostly what Mr. Campbell mentioned in the beginning about the different companies. And when I was helping someone go through and trying to pick out a plan, the particular company, and I can't remember the name just right off the top of my head, but the particular insurance company, everything that they had listed as far as the doctors they have and the medications that they take, when help trying to pick a plan, it covered no one on that list. So that basically narrowed it down to only one company, so there's not the newer companies don't have that network that maybe Ambetter does. But for the most part, some of the highs were just talking to people and finding out that, oh, I've already done it. I'm on top of it, and no, I didn't get to help them sign up, but just knowing that they were taking the initiative to go ahead and take care of themselves for their overall health was definitely a high. Just the amount of people who were already on top of it when it came to November 1st, So that's really been my high and low. It's just the option with the companies and the company not, being a part, the doctor not being a part of the network that they, that the person is already accustomed to and everything. But like I said, just the initiative of the people that I know who have had coverage through the ACA for years, just being on top of it. When November 1st came, they were ready.
Perfect. We've all seen the common factor here. We're just making sure that we're helping people understanding what is the Affordable Care Act about. Before we go to anyone else, let's have another brief commercial. You just watched this short video. All right. I hope everyone enjoyed that brief commercial. Now let's get back on the. Let's get back to about this last week of open enrollment. Let's see, Ms. Loretta Miller, would you like to share? Ms. Loretta Miller, are you able to share?
She's not ready.
Hey, Ms. Albright, could you introduce yourself since you're unmuted?
Good morning, everybody.
Good morning.
This is Phyllis Albright. And I don't have anything to share either.
Quite all right.
Brother Duke.
Yes, sir. Not.
Yeah. When I was introducing and talking, Sister Knox wasn't closed, but she closed now. I know that she have any remarks or not, but one of the main things that I have noticed and we have gone through is we noticed that there's a lot of people who want to get the health care, and a lot of them did get it. The thing in our area was a lot of truck drivers and farmers. They got that damn better. I heard one young lady talking about that damn better, and they got that damn better, and they just as happy and pleased as they can be. And we had another young lady who wanted to, she was retiring and she wanted to sign up, and we set a meeting with her so she could meet us in Enola. We got to Enola. She didn't show up when she found out that she would have to pay something, and she wouldn't even show up to find out how much she had to pay. And so we didn't get a chance to communicate with her. She didn't call me back, and I didn't, I was so sure she's going to come. I didn't get her number to call her. But a lot of times they want to sign, but when they find out that when you get affordable care, you got to pay something. It may not be much, but you're going to have to pay something. And so she changed her mind. But the good thing I like about it is in this area, a lot of truck drivers and farmers, they got that damn better, and they get as pleased they can be. All right, that's it. I just want to share that before we get off of there. Thank you very much.
All right,
And
thank
again,
you, Pastor
y'all,
Knox.
we doing a wonderful job. Can I say we doing a wonderful job with Oak Hill. Thank you, Oak Hill, for the beginning of this. I've been with Oak Hill for a long, long time. I don't even want to try to count the years, but I've been with them for a long time. It's been a great help in my area for many people.
Thank you, Pastor Knox. We appreciate all the hard work you do, you and your wife do, and as well as every team member that's on here. Let's see. A few more people have joined us. They can introduce themselves. Ms. Barbara Young, are you available to speak and introduce yourself?
Good morning, everyone, or good afternoon. This is Barbara Young from East Mississippi here in Meridian, Mississippi. I really don't have anything to share. It's about the same that everyone has said. Is basically Pastor Knox, I think, or Dr. Knox, when they said they find out that they have to pay something, it changes their mindset a little bit. And I do have one client that is really, really working, and she's done her homework as well. So that's a good thing. Is when they do their own homework and realize that what they need and how to go through the process. So that is what I would like to share. And yes, it is a great team. So thank you for letting me be a part of it. That's all, Brother Duke.
Thank you so much, Ms. Young. Thank you for being a part of Get Covered Mississippi. I see Ms. Barcy Evans. Would you like to introduce yourself?
Good afternoon. Yes, my name is Barcy Evans, and I'm here in Greenville in Washington County Opportunities. And I did have a little situation that was kind of different. I had a parent who she wasn't sure if it was time to renew for her children's chip yet. So we got together, we contacted somebody at the Medicaid office, and she was told to they didn't send out the renewal forms. They didn't send any out for the month of December. So to just wait and not do anything until she receives something, but everything was still active. So that was a little different.
Thank you for that, Ms. Evans. I appreciate all the hard work that you are doing as well. Anyone else that I missed that would like to introduce themselves before we go to something different?
Hey, Doug.
Hey, Miss Candace, how are you?
I'm all right. I just wanted to introduce myself and give a few highs that I've had. My name is Candace Shigop, and I am a navigator and a sister here in Panola County, but I definitely work further than Panola County. I have had people who have just been absolutely amazed at the prices that they have received to get health care, not just health care, dental and vision as well. I am currently working with a lady in another county that is planning on retiring. But my most absolute favorite thing is my 26-year-old who I am getting signed up, finishing signing up today. And Lord knows, going to urgent care has been $120 a pop. So I will be so thankful for him that he will now be able to go to the doctor. And two, if you're needing to go to urgent care, it's not going to cost you over $100 to be seen. So we have definitely, not only have I enjoyed it as working, I have enjoyed it personally in my own family.
Thank you for that, Ms. Shegog. And I personally can attest to that because I do have Affordable Care Act insurance. I signed up through Marketplace a few weeks ago, and it is really it's helpful. So I'm glad that I don't have to pay those 120s, 150s every time I go to urgent care or something of that nature. I never understood the value of health insurance until I got a little older. But it's definitely important to have. And also, this week, CMS has made this week the for young adults week of action, ages 18 through 34, and I'm in that range. I am 28, so I signed up for that insurance, and so far so good. I'm making sure that I do all my appointments. There may be others on the call who are under the Affordable Care Act. If you'd like to share about that, you're more than welcome to. Um, let's see.
Brother Duke.
Yes, ma'am.
Hey, this is Miss Young again. This is Barbara. Let me just share real quick that I am as well a part of the Marketplace Affordable Care as a retired educator. State insurance is quite healthy. And it has really come in handy, not just for myself, but for those that are a part of my family and my church family as well. So just know it's very reasonable for those who are seeking it. Thank you.
Thank you for that, Ms. Young. Anyone else would like to share if they're on the Affordable Care Act?
I was on at one time when I was before I turned 65, but my son, he was on, and while he was on Ambetter, he became sick and got diagnosed with cancer. But Ambetter paid for his entire cancer. What they used a new treatment on him, and the treatment was well over $100,000, something that we could not have afforded at all. But Ambetter paid for the whole entire thing. So I am so appreciative of the company because if we did not have it, I don't know if we would have been able to get that type of procedure that he needed to help with his cancer, and he's now cancer free. And Ambetter has really been helpful to us as a family. But also, I would like to share some of the highs and lows that I've had. One was all the highs was the people, everyone that I serviced last year came back to me this year to get the insurance back, the Affordable Care Act back again, and everybody that I helped was able to get it at a reasonable premium. Even though it went up $5, they were still happy for that. I had one person, the low was one of the people that I serviced last year, he underestimated his income. He was self employed, he underestimated his income. So when he filed his taxes, it hit him real hard. But he still came back and wanted the insurance again. But this time he was careful to instead of underestimating his taxes, his tax lawyer told him what to put down as far as his income goes. And so hopefully he had a very high premium, but he wanted it. He wanted it. He didn't have a problem with it. And the year before, his premium was like maybe 150. Now his premium is way over 150. But that's what he wanted. That's what he could afford. And he was grateful that he was able to get the insurance at all. So even though some people may not be able to get a low premium, they're still grateful because they're able to get insurance, and that's what they know they need, the health insurance. So don't be discouraged if some people you talk to them and their insurance or their premium is not as low as you want it to be. They still may want it because they know they need the insurance.
Thank you for that, Ms. Finner. We're glad to hear that your son is now cancer-free. Praise God for that.
Amen. Have we mentioned that with each marketplace plan that people do get the 10 essential benefits that they automatically cover for whether they meet their deductible or not? Have we mentioned that?
Since you're speaking on it, you're more than welcome to go ahead, right ahead, and then we'll come to you, Brother Campbell.
Yeah, there's Mr. Campbell probably do a better job at explaining it, but there are essential benefits that a person receive a plan in the marketplace that's covered where you don't have to meet your deductible. And those essential benefits cover the things like your annual physicals and things of that nature, women health checkups. I'm looking it up I'd hate to just talk off the top of my head, but I just want people to understand that if you
Sister Wilson,
on yes,
I can actually post
I just
the
want them to know.
presentation and list all the essential benefits as well as the preventive.
Yes, that's what I want to get to, the preventive, because they don't. Yeah. Because you have preventive care, you have vaccinations you can get, medical screenings. They're not subject to cost sharing or any type of deductible. You have lifetime caps on certain benefits that a person can receive health care. And one thing that's very important, if you reach your deductible amount, your annual amount, guess what? You don't pay anything else out of pocket once you reach your limit. That's all I had to say.
Thank you for that, Ms. Wilson. Brother Campbell, would you like to share? If you're speaking, Brother Campbell, you're muted.
Right, thank you, Duke. I kept clicking on mute and it wasn't working for me. New share, let's see if this is working. All right, so we've talked about the essential 10 health benefits and that they exist. So this is just a listing of the essential health benefits that all marketplace plans have to cover. And it starts off with ambulatory patient services like doctor and clinic visits, emergency services, ambulance, first aid, rescue squad, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, including behavioral health treatment, covers prescription drugs, rehabilitative and habilitative services like therapy sessions, wheelchairs and oxygen, laboratory services, preventive and wellness services, and chronic disease management like health pressure screenings, cholesterol screenings, immunizations, and pediatric services, including dental and vision care. Now, I'm going to talk about the preventive care benefits in just a second. But as we were talking about the premiums that people have to pay, and sometimes when I'm working with a consumer and I pull up their plan and it says that they might have a $80, $100 monthly premium, I make sure that I point out to them just how much they'd have to pay for the plan if they didn't qualify for and receive the advanced premium tax credits. And that kind of gives a lot of people a different perspective of the value of what they're getting, although it's always going to be more than not paying anything. But through the Affordable Care Act, you do get really quality plans that can come to you at a greatly reduced savings. All right, so these are the preventive care benefits that are covered through marketplace plans, and these are done or paid for even if you have not paid down your deductible. And it starts off, there's a bunch of them. Abdominal aortic aneurysm, one-time screening for men and women of specified ages who haven't smoked, alcohol misuse, screening and counseling, aspirin to prevent cardiovascular disease, colorectal cancer, blood pressure screenings, cholesterol screenings, colorectal cancer screenings for adults 45 to 75, depression screening, diabetes type 2 screening for adults 40 to 70 years old who are overweight or obese, diet counseling for adults, fall prevention with exercise or physical therapy, hepatitis B screenings, hepatitis C screenings, HIV screening for everyone age 15 to 65, pre-exposure prophylaxis, HIV prevention medication for HIV negative adults at high risk for getting HIV through sex or injection drug use, immunization for adults, lung cancer screening for adults 50 to 80 at high risk for lung cancer, obesity screening and counseling, STI prevention and counseling for adults, statin medication, prevention medication for adults 40 to 75 at high risk, syphilis screening for adults at high risk, tobacco use screening for all adults, and cessation interventions for tobacco users, tuberculosis screening for certain adults without symptoms at high risk. And so the big thing about these is if we go back to the old cliche, an ounce of prevention is worth a pound of cure. And so even with the high copay bronze plans that people may get, they may not be able to pay for some of the expensive procedures, but they get all these different preventive care benefits at no cost to them. So they can go in and possibly prevent having to need the more expensive procedures by stopping the issue before it becomes a problem. Yeah, let's see, anything else? And that's about it.
Thank you, Mr. Campbell, for sharing that amazing information. I see we have a hand up, Miss Loretta Miller. Miss Loretta Miller, are you able to speak? I see your hand is up.
I do have something. this year.
Miss Loretta, you have a bad connection.
Brother Duke, as I was making my calls during this session, well, actually, I remember in the training they said that they were going to place. Can you hear me next? I missed what you said, Brother Duke. Should I continue?
Try now. It's sounding smooth for right now.
Okay. And I'm going to try it without my video. Okay.
Okay.
So, one of the things I experienced this year is I remember during the training, healthcare.gov was going to be advertised on television. It was going to be in beauty shops. There was going to be advertisements in barber shops and laundromats, just everywhere, clinic, doctor's offices. So while I was making my calls, and I have seen it in different places, in these different places, I've seen posters up about healthcare.gov. So I was talking to one of the constituents, and she was saying that her Medicaid had been cut off, and she didn't know if she was going to have insurance, and she didn't know if what she was going to do. And so I left her my number to call me back. So I gave her the information. So when I called her back, she was telling me about her experience. She had gone to the doctor, but her daughter had gone into Marketplace, healthcare.gov, opened an account, put her and paid. And so she had insurance through through the Marketplace. And it's all because her daughter knew where to go to get the insurance. Her daughter knew to go to healthcare.gov to get a text out to people. And so she said, well, my daughter said she was going to get it. And in actuality, her daughter did get it just in time, because during that time she did have to go to the hospital. She did have to have the surgery, and it was covered. Advertising with everywhere that the word people are able to see that insurance works. Do call us or go to healthcare.gov. Insurance is available, and it's simple, and you can do it. Just give us a call, and we'll help you walk you through.
Thank you for that, Miss Loretta. See, we have a few more of our team members join in with us on today. I'm going to give them a moment to introduce themselves. Also, I want to recognize someone from CMS that has joined us from Atlanta, Ms. Tamika Miles, health insurance specialist for CMS. Thank you for joining in with us on today. We'll go to Ms. Lori Rogers. Are you able to introduce yourselves and give some highs and lows about how you've experienced during the open enrollment season? Is Lori Rogers? If not, Ms. Vanessa Jackson. Like to introduce yourself and give some highs and lows about the open enrollment season for you? If not, we can go to a brief commercial and allow people to go to a brief commercial.
I'm glad I chose Ambella thanks to Candy Shiga. She helped me with the program. It's affordable. Um, I'm just glad I got to get on there.
Thank you for those testimonials that we have received to share with everyone. We're winding down. We're on the last 27, 26 minutes remaining in our telethon. We see we have our head person on, head man, our boss, Dr. Michael O'Miner, if you would like to share. No, we can't hear you. Okay, we'll come back to you. All right. Anyone else like to share about the highs and lows? We don't want to miss. We don't want anyone to miss out on anything. Um, Also, we have a few announcements. Our next third Wednesday parent resource chat is January the 17th at 11 a.m. The next Ask Mary and Pat webinar will be January the 29th, and we will send out reminders for that. Also, download the app, Oak Hill Regional CDC app. So you can search it up in the Google Play Store as well as the Apple App Store, and you'll be able to get information there. We send out push notifications from time to time. So just check us out. We're available pretty much on every social media. Follow us, Get Covered MS, Oak Hill Regional CDC, Healthy Kids MS. I see we have some more navigators on. It's Karen McKnight. Would you like to introduce yourself? I just don't want to miss out on anyone who would like to introduce themselves so everyone can know who you are. I'm Miss Alice Jackson. Just calling out names. All right. Ms. May Stigler, are you able to introduce yourself and give some highs and lows as far as it pertains to open enrollment? If not, I do want to remind everyone that the open enrollment ends January the 16th. Official time will be really 4 a.m. January 17th, but we want to make sure you have all of January 16th to get enrolled. And again, that number is 662-298-3584. You can text us 662-689-9712. Now we can go to let's do a slideshow of our
And then as soon as the slideshow's there, we'll be ready to rock and roll, dude.
Okay, we'll do this quick slideshow to show our recap for 2024. I mean for 2023. Now we're going to turn over to our Executive Director, Dr. Michael O'Miner.
All right. Good afternoon, everyone. Good morning, whenever you're going to be watching this. I apologize for killing the tail end, but I have been on the road today, and I'm telling everybody to make sure they have an opportunity to get enrolled before our open enrollment season ends. I want to say, Duke, it reminds me of 10 years ago. We're doing through our first enrollment back in 2014. And we're trying to wrap up and get things going for people. So, look, some folks are thinking that we're just only doing anything for the Affordable Care Act, Obamacare. But we're also helping people with Medicaid and CHIP renewal. We're also helping people that need a connection to a federally qualified community health center. We've been fielding calls from people that have questions about Medicare and the Veterans Administration. So look, if you got questions about insurance, give us a call, 622-298-3584. As I always say, it's great to have assurance, but you need some insurance. I was blessed today to talk to a group of pastors to share with them, and they're going to be sharing in their congregations in their Bible study and on Sunday, if the weather permits up here in North Mississippi, about it. So I challenge everybody that's watching. We know that we're going to be repeating this telethon on Thursday. So I challenge everybody, you know, your family, your friends, your frenemies, tell them about it. Look, if they're on Medicaid and CHIP, they may think it's all set because they joined on it during the pandemic, and it was continuous renewal, and now it's not. So they may not realize they don't have coverage. Do that. So we want to make sure we get that done. I've heard some great stories of people who thought that they were never going to get coverage again. Our navigators worked with them, got through the paperwork, they got renewed. They were so happy. We've had stories of people who've come in and thought it wasn't going to be affordable, and they got a zero premium, zero deductible with help because where their income level was. Well, look, you may not, when you get go through the process, it may not be as low as that for you. But let me tell you something. If you go to get sick and go to the hospital, a bill can be $200,000. So let's do everything we can to work and get covered. We want to get covered and stay covered. You hear what I'm saying? All across the Mississippi. We want y'all to get covered and stay covered. You hear what I'm saying? Get covered and stay covered. Get covered and stay covered. I'm going to say it one more time. Get covered and stay covered. Get covered and stay covered. Now look, when we are done with open enrollment, whether it's Monday or Tuesday at 4 a.m. In the morning, and I guess Duke will be up by himself, we're still going to be working. If you got questions once you have been covered, give us a call. If you come about and you get married or have a baby or you lose coverage on your job, contact us. We'll see what we can do about a special enrollment period to get those things done. If you are 63 and you're thinking about up for Medicare, give us a call. If you got a relative that you know is a veteran and they have not signed up for their coverage, give us a call. If it's anything about insurance, give us a call. Look, if we can't find the answer direct, we'll work to get it done. But look, all across the state, let's do everything we can these next few days. Let's finish strong. Our navigators are ready, willing, and able. We know some of them may be snowed in on Sunday and Monday, but look, even if the lights go out, I know they'll be in their cars, keeping their batteries charged up, ready to answer your call. So, fellow Mississippians, there's no excuse for you not to get covered in what we're doing. Like I said, I'm on the road now. If the weather wasn't so bad, I would do like I did some years ago. I just get on this highway and drive all the way down to the coast and just yell it from the rooftop to get covered Mississippi. But look, on behalf of our board of directors of Oak Hill Regional CDC, our project director, Alani Minor, for Get Covered Mississippi and Healthy Kids Mississippi, we want you all to support us in getting this done. For us, it's ministry first and the work that we're doing. Duke, I appreciate you on our team and all the navigators on there and the things we're doing. Let's finish strong. Remember, even though we might be in the ice and snow on Monday, MLK Day is not a day off, it's a day on. So once again, Mississippi, let's get covered. Duke, I'm going to turn it back to you to close us out.
Thank you for that, Dr. Minor. Get covered and stay covered. We really appreciate you coming on and giving us our final closing statements. If there is nothing else that anyone would like to share, we will close out. And hope you guys contact us. Again, the number is 662-298-3584. You can text us 662-689-9712. We're going to end the live stream on Facebook. If you have any questions, please put them in the comments and we will be able to come back to you and answer those questions. Again, we will premiere this video again on Thursday. So if you missed it, you have an opportunity to watch it then. So thanks everyone for joining in, and I hope you guys have an amazing rest of your week. And get covered, Mississippi.